Hello everyone, welcome to this channel. Today, we will discuss myths and facts about breast cancer. People may not be able to distinguish between myth and fact when it comes to this disease, such as who gets it and why, or what treatments entail, unless they have breast cancer in their own lives or are close to someone who does. Although breast cancer is one of the most well-known and frequently discussed malignancies, there are still a lot of myths floating around. We keep coming across some of the same falsehoods in this video. The list that follows includes a lot of them. Breast cancer is frequently believed to be an inherited condition. However, only between 5 and 10% of breast cancers are thought to be hereditary, meaning they result from aberrant alterations or mutations in certain genes that are passed down from one generation to the next. The vast majority of women who get breast cancer do not have a family history, indicating that other factors, such as environment and lifestyle, must be at play. However, doctors frequently are unable to explain why one individual develops breast cancer while another does not. Being a woman and being older are the two highest risk factors. Healthy breast cells may spontaneously mutate over time, resulting in the development of cancer cells. Even so, it's vital to take this risk seriously if you have a significant family history of breast cancer on either your mother's or your father's side. Inform your doctor if you have any near blood relatives who have experienced breast cancer, particularly if they were diagnosed before the age of 50. You should also mention any family history of other cancers, such as ovarian and prostate cancer. There have been persistent reports that underarm deodorants, particularly those made with aluminum and other chemicals, enter the lymph nodes and enter breast cells, increasing the risk of breast cancer. It was believed that shaving the underarms would exacerbate this by causing tiny nicks that would allow more toxins to enter the body. According to a different notion, antiperspirants reduce cancer risk by preventing the discharge of harmful chemicals from the underarm lymph nodes by reducing underarm sweating. However, there is no proof that using antiperspirants increases the risk of breast cancer. However, recent research has shown that breast tissue from women who use aluminum items under their arms is more likely to contain higher levels of aluminum. We frequently hear this from newly diagnosed women: I eat well, I maintain a healthy weight, I exercise regularly, and I hardly drink. Why then did I have breast cancer? There is proof that each of these actions can help reduce risk. They cannot, however, promise that you won't develop the illness. There are countless instances of people who follow all the appropriate guidelines yet nevertheless develop breast cancer. Managing the risk factors you can influence, such as what you eat and drink and how active you are, is unquestionably worthwhile. However, it's still crucial to have routine checks, check your breasts for abnormal changes, and undertake monthly screenings. Additionally, if you have any health nuts friends or family members who believe they will never have breast cancer, make them realize that no one is 100% safe. People have claimed that since most breast cancers are brought on by causes that are beyond our control, the emphasis on environmental and lifestyle variables can be misleading. They continue, there's a notion that it's your fault. Don't beat yourself up. It's not your fault. There are risks in everything in life. The internet and media coverage have occasionally fostered the idea that wearing a bra increases the risk of developing breast cancer. According to the notion, wearing a bra, particularly one with underwire, could prevent lymph fluid from leaving the breast, which would lead to a buildup of poisonous compounds there. However, there is no evidence to support this claim. According to a 2014 study involving 1,500 breast cancer survivors, there is no link between bra wear and the illness. According to media reports, wearing a cell phone in your bra may increase your risk of developing breast cancer. Some younger women have developed breast cancer as a result of routinely storing their cell phones in their bras. These worries were heightened in 2013 when the Dr. Oz show advised ladies against storing their smartphones in their bras. However, there is simply insufficient information to back up this assertion. The majority of research so far has been on determining if cell phone radio frequency radiation raises the chance of developing brain cancers. Unlike high-energy radiation employed by X-rays, for instance, this radiation has a low energy. The problem is still being researched, but this research has not discovered a connection. Nevertheless, cell phone manufacturers frequently advise keeping your gadget as far away from your body as possible. While there is no conclusive evidence linking cell phone use to breast cancer, you might want to wait until further study is available before carrying your cell phone in your bra or chest pocket. Sometimes people believe that breast cancer invariably results in a lump that can be felt when performing a self-exam. They may argue that they won't need a mammogram because they can feel any changes that might be problematic. However, a lump is not usually the result of breast cancer. By the time it does, the cancer may have spread to the lymph nodes and away from the breast. Although completing breast self-exams is undoubtedly a good practice, mammography screening should still be done on a regular basis. Other misconceptions about the types of breast lumps that are less concerning include, if the lump is painful, it isn't breast cancer, and if you can feel a lump that is smooth or that moves around freely under the skin, it's not breast cancer. Any lump or unusual mass that can be felt through the skin needs to be examined by a healthcare provider. There is always a chance of breast cancer even though the majority of lumps are benign, not malignant. There is a widespread misconception that sugar can feed the disease and hasten its growth, and this misconception applies to many types of cancer, not only breast cancer. Whether they are healthy or cancerous, all cells require the blood's glucose as sustenance. Although it is true that cancer cells metabolize sugar more quickly than normal cells, there is no proof that consuming an excessive amount of sugar leads to the development of the disease. A study in mice revealed that eating too much sugar might increase the risk of breast cancer, but additional research is required to confirm any association in both animals and humans. Having said that, it is well known that eating too much sugar can cause weight gain, and that being overweight increases the risk of developing breast cancer. Additionally, some research has connected diabetes to an increased risk of breast cancer, particularly more severe, advanced forms of the disease. Researchers are unsure whether the association results from patients with diabetes having higher blood sugar levels or from their propensity to be overweight. It's usually a good idea to limit desserts, candy, cakes, sweetened beverages, and processed sugar-containing foods for health reasons. It's vital to read food labels because many items may include hidden added sugars like high fructose corn syrup.